Welcome to Suwanee Dental TV. I'm your host, Candace Felice. Today we'll be talking with Dr. William Williams, who actually started Suwanee Dental Care Practice along with the partnering physicians that are with him. We'll learn some new techniques and we'll learn valuable lessons in taking care of your teeth to prevent other health issues. Thank you for joining us, Dr. Williams. What can we expect from Suwanee Dental Care?
Well, we're here to serve the people of Gwinnett County and the surrounding metro Atlanta area with the latest state-of-the-art dentistry and the most comfortable, pleasurable style that they can imagine. We've added new facility features like this resting room that we're sitting in today with the fireplace, with the massage chairs. We've added 5 new operatories. We've got a new large reception room. So everything that we've done in the renovation has been to increase the comfort and the efficiency for our patients.
During our new patient interview, which we do with every new patient, we spend about 20-30 minutes kind of getting to know them, getting to know their background, understanding what their dental experiences have been like in the past.
Well, I think it's important, to be in the community that you're serving, and I felt even after living in another part of Gwinnett County, having a practice in a different part of the county for a number of years, after I hooked up here, I could have stayed where I was. I was only about 15 miles away, but I felt like I needed to be getting to know people in the community.
Most of us are familiar with extreme makeovers, and you have a procedure here called the smile analysis. Can you explain to us exactly what goes into making a smile analysis?
When a patient comes to us, they've got some real concerns about how they look. We look at them in a way that breaks it down with the smile analysis. That'd be like 21 different points that we make about their smile. How do the lips look? How do the gums look? How do the teeth look? Their color, their arrangement, their alignment. And by the time we've gotten through this smile analysis, we have a plan of action of how we would fix their smile to make it unique and distinct, but very beautiful for each patient.
I really enjoy doing the extreme makeovers, the veneers, those types of things. They seem to bring excitement to patients' lives, and they bring excitement to the dentist's life who's able to do it. And with the new technologies and materials, it's just a wonderful thing.
Dr. Williams, tell us what makes Suwanee so unique?
What I like to think is that we're a comprehensive dentist, and that means that we provide all the work for all the specialties here at this one practice. So a patient doesn't necessarily have to go to an individual specialist for each type of procedure, where some practices will only limit themselves to restorative dentistry. We do the surgical, the orthodontic, the endodontic, and the periodontal services here in addition to the restorative dentistry.
Suwanee Dental Care is just a breath of fresh air. This is not your ordinary dental office. There are things here, technologies, availabilities, and skilled dentists that are able to do any type of treatment that you might need.
For those of us who have an aversion to needles, can you explain to us the procedures that you do that don't involve needles?
Well, fortunately, we have a lot of tools and techniques that may impress a lot of people with what used to be versus what is today. Things like the wand, which is an electronic anesthesia machine, very useful for comfort. We've got air abrasion, which means you don't even have to drill the tooth. You can just blow air and sand particles on the tooth and it takes away the cavity. We've got lasers, which are very useful for taking away cavities without anesthesia. And there's always the good old TLC. If you gotta have Novocaine, you just do it very comfortable.
Can you tell us more about sedation dentistry?
Sure. Sedation dentistry is very good for the fearful or phobic patient. As you mentioned before, a lot of people have a fear of needles, fear of the dental drill, fear of just kind of the unknown of what might happen, and that tends to keep a lot of people away from the dentist for many years.
Now, obviously, we do have sedation dentistry available for those people that do feel like they just don't want to deal with things and want to be kind of put out, and so we're glad to do that. And we can do a lot of dentistry at one time, using the sedation dentistry.
The sedation we offer here is a pill-type sedation, a little different from IV sedation and a little different from general inhalation procedures you might receive for a hospital surgery. Quite safe, quite effective.
Another procedure for phobics of pain is a procedure called CEREC. Is that correct?
CEREC is quite good for people that are phobic, that don't like coming to the dentist. The CEREC machine manufactures basically all porcelain crowns, inlay pieces for teeth in one visit. It takes a traditional two-step visit for a crown and makes it a one-step visit. So it's great for fearful people, great for the busy professional that just doesn't have the time to come in. I found it's also very good for people that are kind of, in the area, maybe visiting relatives, need a quick procedure, leaving town in a couple days. It's really effective in Florida for that procedure because we had a lot of people that were in and out snowbirds.
And for people who just want to brighten their smile up a bit, just give it a little extra pizzazz, would you recommend porcelain veneers or bleaching?
Well, I always try to recommend, firstly, the least invasive procedures that we can do for people. And sometimes if they're happy with the way their teeth are shaped, the length of their teeth, and all of that, and just want some fine-tuning as far as the whiteness to their smile, then I'm going to recommend, bleaching. And we have multiple techniques for doing bleaching. The big problem that people have had, over the years that we've not been able to address in dentistry is bleaching tetracycline antibiotic stained teeth. And we actually have a new technique of power bleaching where we can actually have a much better result, with tetracycline stains now as well. But if they have spaces between their teeth and they have misshaped teeth are at different levels, and need to be evened out, then I'm going to be recommending, that you go to, the veneers, because that's going to kill two birds with one stone, so to speak. I can whiten your teeth and correct all the shape and length and so forth of the teeth all at the same time.
And another big dreaded word, root canal. Can you explain to us exactly what a root canal is?
About 95% of the people that have to go through root canal procedures have absolutely no pain, no problems, and come out just so appreciative of being able to get out of pain so quickly. 5% of the people, a lot of times because they wait too long and the infection is so great, have a lot of problems associated with that. And I always tell people, the 5% of the people are the people that you hear from. The 95% of the people that don't have any problems never go around telling their friends, I had a great root canal today. You just never hear that. So the people that you hear from are only that small percentage, And the technology has come so far to the point now where we can do it so quickly and so efficiently and one step. It used to take multiple visits to the doctor to get, root canal work done. But we've got the technology here to be able to do it painlessly, quickly, and it really has come so far.
Thank you, Dr. Williams, Dr. Smith, and Dr. Haywood for joining us today and answering the many questions and myths about dentistry. And thank you for joining us today on Suwanee Dental TV. For more information, go to SwaneeDental.com. Give us a call and we'll make your smile brighter.